We are going to take a look at a very unique family. The families of the 90s can no longer be defined as mom and dad, a little boy and a little girl. Now families are defined more by the bonding of people who really love each other through happy times and tough times. The kind of love that Peggy and Allison share with their 5 adopted, terminally ill children. Molly, at 3 years of age, has cerebral palsy and cancer. 2.5-year-old Bee, 7.5-year-old Lucy, and 4.5-year-old Lottie and Ida were born with the AIDS virus. Life expectancy of these children is difficult to predict. Some die within their first year of life. Others live to be 13, 14, or more. But no matter the prognosis, Peggy and Allison strive to fill meal times, learning periods, and playtime with fun, caring, and a big dose of love. And just so you know, there's Bee, who is the most sociable child you'll ever meet, running around. Hi, Bee. And Ida's on the floor, and Lottie's on my lap. Lucy is on the couch, and of course, she's a television veteran here. And Molly, with a big smile, is right here. Peggy, Allison, great to see you again. We won't make it a secret that we know each other pretty well. I remember the very first time we met, you told me that you had raised your own 6 children and then got colon cancer and survived it and decided to do something. Had you made a promise? Is that why you're doing this?
No, not really. I already had a severe empty nest syndrome.
Did you?
When we went into cancer. And coming out of it, life changes so much when you're surviving those kinds of things. It just changes your priorities. And in that way, we really did decide to make a life change.
5 children now, and working on
number 6.
Number 6.
Yes.
I think the question that everyone would want answered is, how do you deal with the prognosis? How do you emotionally deal with what probably will be inevitable?
I think we both deal with it a little bit differently, but as a family, we're very united in that we consistently deal with it every day. We don't focus on it, we don't dwell on it, but we do know it's there. It's always there. It never goes away for us, and in that way we're never taken by surprise.
And Allison, so many ups and downs. Lottie and Ida, now you were against AZT, didn't really want that, but had no choice. They're on it now.
Their blood levels had gotten so precariously low that we really were confronted with do something or risk their life. Even though they really have always looked the way you see them presently, they in essence their blood levels were extremely low.
And we're talking very low. Yes. 1900 is normal, and they were down to 100, you were telling me?
In the high hundreds.
Yeah.
How are they doing now?
It's relative. They now have some of the side effects of AZT. The illness is progressing with the vomiting, the neuropathy. Developmentally, they're doing very nicely. In terms of their eating and their weight gain, they're holding their own.
But they really can't take solids. I mean, Lucy, you don't eat solid food, do you, honey? Do you get sick when you eat solid food?
Yeah.
Do you? Do you remember the first time you were here with me? Do you?
I remember I was a little tiny baby.
You were almost a tiny baby, yeah, and look at how much you've grown. And that is the most amazing thing, because when we first met in 1988, the prognosis was not great, was it?
Well, she came home at 2 years old with a 6-month prognosis. So there's
Lucy, and there's Ida.
Yes.
Yeah. You know, it was an interesting thing. I had just had my baby Ryan, and I was holding Lottie on my lap, much like I am now, and she was drooling on me. And after the show, I got all these calls saying, you know, you could have taken the AIDS virus back to your baby. I hope we helped dispel some myths with that.
Yeah.
If I had an open wound, let's talk about that. Would I have taken the AIDS virus with me?
No. They have documented that the virus does live in the sputum, but in very exaggerated laboratory conditions. They really haven't isolated that, even in the sickest of patients.
What? Say it out loud. What, Lottie?
Why are they talking over there?
Why is everybody talking over there? Because that's the monitor. Can you see yourself? See, look at, there you are. Can you smile? Yeah.
I think that also what what we've been exposed to with Magic Johnson and his playing in the Olympics is indicative of, they're already saying that there really isn't any risk that if he were to even bite someone or bleed, that anybody, it's infinitesimal risk to anybody else. So I think you're going to hear more and more of that in the present time of how there is no risk. And when we were on the show before was several years ago, and a lot has been learned, and a lot of people have become educated, so...
But you still, the Australian team refusing to play, in the Olympics of Magic Johnson plays, clearly we are still a long way from understanding all the facts.
Absolutely.
Talk about Molly's condition. Now, Molly has cerebral palsy, right?
Molly has most of her brain missing, which is why she has cerebral palsy. She also has hydrocephalus. She's had cancer and had a kidney removed, and her remaining kidney is quite diseased. So her prognosis is very poor.
Is it? And developmentally, though, quite amazingly.
When Molly came to us, Molly came on 3 machines, a breathing machine, 2 feeding machines, and we were told that she was profoundly retarded, blind, and that we would just be doing custodial care. And within 3 months, she was off all of the machines, all medications, and right now she's testing developmentally age-appropriate.
You know, Bea and Lottie and Ida were all 3 born drug addicted.
Right.
What happened to little Bea, who's behind us over there, and I don't know whether we can even see her. She's on the stairs having a great time. At birth,
she was born at 2 pounds. 3 months premature, as was Lucy, born at 2 pounds, 3 months premature. Lottie was also premature. And they deal with they were all drug addicted at that point, drugs in the system. Now they say that wanes. However, the nerve damage, and as we know, holes in the brain, the birth defects that Bea has to deal with. She has several birth defects that she copes with. All of those don't go away, and all of those are drug related.
and she had a stroke.
She had a stroke at birth because she was so premature. Her lungs are very immature, so she's constantly battling upper respiratory infections, and it has really affected her growth. She's a very small child for her age.
Everybody out there saying to themselves, boy, I have a hard time getting my 2-year-old and my 4-year-old together to go shopping. How in the world do these 2 women do it? We're on right now. There you are. We're back talking with Peggy and Allison and this wonderful family of young women. Not long ago, you were offered a little boy. Now, there was a reason why you want to keep this all female. Is it because of the living situation? Changing the beds, the bedrooms and all of that?
We never chose to have it all female. We did try several times to get little boys, but when we got to the last bedroom, that's a very large room with 3 beds, we said to the social workers, this is it, you have to give us the boy now, or, once we put a girl in the room, we have to maintain girls.
Sure.
Just because of we have a 9-room house, but the room is not infinite,
Having been there. Lottie, come over here with me because I want to tell everybody about... Lottie,
could you listen to her?
Come here. I want to tell everybody about the most special thing that ever happened to me.
But we need a microphone.
Well, let's get the microphone. The most special thing that ever happened to me was when your moms called and said, would I be your godmother? Do you remember that?
Yeah.
Do you remember that? When you looked so beautiful? Look there you are at your christening. That was the most special thing for me. You know it? And I'm proud you're my godchild, except I'll tell you, like probably everybody watching, I wish I was a fairy godmother and I could wipe all of this away. What have these children taught you?
Unconditional love, I think. Accepting, trying to just, we can accept them unconditionally. We deal now with unconditionally. We can't deal with the illness unconditionally and all that comes with it. However, I personally still haven't learned that.
In what way? Help us understand.
At night, when you go by to check everyone, is someone breathing? Are they not? Every time Lucy's temp goes up to 104, which was 3 times last week, is this the beginning of something that's going to be terrible? Do you know, that's very difficult to learn to cope with unconditionally.
Very hard. And, I'm just thinking about the child that doesn't have this diagnosis or any of these and how much mothers worry, and yours must be so extraordinary. How did the 2 of you get a social life? How did you get these 5 wonderful children ready this morning?
We started yesterday. I'm very organized and efficient, and so I do some aspects of the work that just keep the things moving. Peg does all the creative work, so...
Lottie, come here, honey. Can you put that down here so we can hear your mom?
Makes a lot of noise.
So things like hair gets done the night before, and as many, coats are downstairs. Everything's ready to go in the morning, and then, you just think a little bit more about it.
Are you keen on keeping ethnic traditions going, like with Lucy?
Yes.
How did you learn, for instance, to cornrow and to do it so well?
We make it our business to learn
Oh, my
that. It's really
favorite.
very important for us to. Molly is Jewish. We do everything we can to support that culture for her. We have African American, we have Puerto Rican, Lucy is Haitian. We really make it a point to educate ourselves and focus their education on an Afrocentric.
Stephanie, would you go get Bee so she doesn't hurt herself? She's up there on the stairs. Stephanie now helps you.
Stephanie's our right hand.
Your babysitter, huh?
She babysits, and she's the person that makes our social life possible.
So you can go out then.
Yes, we make it a point that a couple of times a week we deal with lunch, or we have her when we have to bring them to hospital.
And so you have moments then
yes.
where you're all right. How do you do it? You're not a foundation. You were determined you weren't going to turn this into a government-supported issue here, right?
Right.
Lottie, I know you know my microphone's down there, but let's use this one. They're very smart, huh?
Yes.
How do you survive? Financially,
Well,
how do you do it?
We do survive on adoption
Don't
subsidy.
do that, my
We
dress.
have to do that because it's too difficult to try to work and
not
manage
nice.
a life when you have 5 terminally ill children. It's just
I really
impossible.
love you.
Our nights are very long, our mornings are very early.
nice.
And they require a great deal of proactive intervention and care. So we're really on call 24 hours a day into, there's no way, we can't do it any other way.
Are the lights hard on the children?
Specifically, Lucy, it will start to bother the immune system after about 10 minutes.
What's Lucy dealing with now? How are you doing, Lucy? How do you feel, honey?
Talk to Eileen about how you're doing, hon.
Well, this forehead hurts.
Her forehead hurts, hon.
Your forehead hurts, huh? All the time?
Uh-huh.
Does it? And what other things? What other things are hard for you right now?
Sometimes I have lots of things.
Lots of things, huh?
Big temperatures,
Yeah.
104s, hurting all over.
No, play with my room.
You like to play in your room, right? That's very nice. And she's losing her vision rather rapidly. She has about 18 inches of vision now. So that's what she's coping with right now. So she just got her television set so she can
be in a
cope,
room.
Lucy was telling
lay
me.
down in her bed.
Yeah. Do you like to watch television?
Sometimes we hang up.
Yeah. By yourself, you like to watch it, right?
Yeah.
Because you're the biggest girl. You're the big sister, aren't you?
Uh-huh.
Yeah. Your 6 children, Peg. I'm wondering what did they think when you started all of this and changed your life so much?
Well, for some of them, it was very difficult. They needed to educate themselves, as did my mother. That was difficult for the extended family as well. Many have not returned to the full. It's been 6 years, and we still are just beginning to get contact with family members.
That must have hurt you.
Is that a living
We expected it and didn't expect it at the same time, and it was very difficult to cope with. But we had made the decision that this is what we were going to do.
No matter what the
no matter
consequences.
what.
Allison,
And
did you
people
go
did
through
it.
that?
Well, I don't have any children of my own, but in terms of work and family, I think there's always been trepidation. I think my folks, for example, who would they share this with and who not to? I think other people in my life have, had to weigh how much they tell other people instead of being prideful of it. It's something you have to think about. Because how can people can handle it?
We understood in 1988 because the virus was so new and people didn't yet understand, and we were hoping for that information that would let everyone really get the facts. Have we moved forward at all, or are we still where we were in '88?
I think it's like any discrimination. Intellectually, it seems like it's much better, But just under the surface, there's always that hesitation, and irrational fear is very difficult for people to deal with.